Welcome back. Today I want to talk a little bit about that decision point in our algorithm where you need to decide, are you going to refer the patient or are you going to keep the patient in the practice and do the cognitive testing yourself? So clearly adding an evaluation like this to your busy primary care practice is difficult. I want to talk a little bit about some things you might want to consider as you're making that decision. If you do decide you want to refer, here are some things to keep in mind. First things first, who are you going to refer to? I like to remember the rule of the expert. Find someone who makes this diagnosis often. It might be a geriatrician, it might be a geriatric psychiatrist, it might be a neurologist. Sometimes even neuropsychologists get in on making the diagnoses. In your community, look around and find someone who, first of all, does this a lot. Second of all, hopefully they like to do this. It's a complicated diagnosis, and you really do want someone who enjoys working with patients with this kind of a symptom. And thirdly, think about finding someone in your community, maybe who works with a team that might have social workers available to help if the family is having any challenges related to this diagnosis. In some areas, academic medical centers or memory disorder clinics are available and have clinical teams that include doctors, social workers, and other providers who'd be appropriate to help with this kind of a diagnosis. And finally, keep in mind that your local Alzheimer's Association would be a great place to start if you're not sure who to refer the patient to. They maintain lists of professionals who are involved in the care of patients with dementia. You could certainly look over that list and make a decision based on that. If you do decide you want to do the cognitive testing, think ahead a little bit about how and when you're going to do the testing. A few things to keep in mind. First of all, the mini-cog test that we've talked about, which is the 3-word recall and the clock test, keep in mind that that's actually a screening test, and probably either you or even your medical assistant may have done that. You now are moving into an arena where you're going to be using one or more of the validated cognitive tests that get used. That might be the MMSE or the MoCA, are the two that we've talked about. When you're picking the test that you want to use, one thing to keep in mind is that the MMSE was set for individuals who've had at least 8 years of education, while the MoCA was designed for individuals who've had at least 12 years of education. So the higher your patient's educational level, the more you may want to go right ahead and do the MoCA test first. Another thing to keep in mind is that some of your patients may be a little anxious or nervous doing the testing. They may want privacy, and in some cases I think that's probably better anyway, because it'll avoid distractions, they won't be so self-conscious, and you'll avoid the overeager family member or caregiver who just can't bear to see their loved one make a mistake and they want to contribute or help them understand the instructions. You really don't want any of that. You want to be able to do the test exactly as the authors of the test have set it out, so that your instructions are clear and you can feel confident that your individual patient was given every opportunity to do their best. Now, if your caregiver insists that they stay in the room, or if your patient actually feels more comfortable if the patient stays in the room, what I do is I set it up so that there's myself and I'm looking right at the patient. I often will put the caregiver behind the patient so that my eyesight line is to the patient. They can't see the caregiver and get distracted that way. Then you've still got their full attention for the testing. That usually works well.